comment, all that stuff. This is the future. Anyway, Donald Trump said, no way, no more debates. Like, I've had it, right? There will be no third debate. Good for him. Look, his policy is out there. He keeps talking about it every day. She won't talk about policy. He does. Here's the newest. I want to share with you what he's talking about. This is very, very intriguing. I like the idea of less tax, as you know, no matter what. And we want to reward work, do we not? As a society, isn't that the idea? Don't you want to encourage people to work more? Income taxes actually have the opposite effect. So what if you could actually encourage people to work more by getting rid of tax on overtime? And that might actually help employers to get more people to work. Here we go. This is his new one. Wait for it. Kamala's going to take it. Mark my words.
I'm also announcing that as part of our additional tax cuts, we will end all taxes on overtime. You know what that means? Think of that. Think of that. Think of that. That gives people more of an incentive to work. It gives the companies it's a lot easier to get the people. And, you know, I went to some economists, great ones, and I said, what do you think? They said, it would be unbelievable. You'll get a whole new workforce by doing that. No taxes on overtime.
Wow.
The people who work overtime are among the hardest working citizens in our country. And for too long, no one in Washington has been looking out for them. Those are the people. They really work. They're police officers, nurses, factory workers, construction workers, truck drivers, and machine operators. It's time for the working man and woman to finally catch a break, and that's what we're doing, because this is a good one. And I think it's going to be great for the country. So that's why we will be saying that if you're an overtime worker, when you're past 40 hours a week, think of that. Your overtime hours will be tax-free. Okay? Good? You're going to have it, too.
Look, it's a good idea. Okay? At least we get some ideas on the table. She doesn't have any ideas other than handouts. At least this is not a handout, right? Shouldn't America be about hard work and getting ahead because you're willing to put in the sweat equity? You don't want things like inflation eating up all of your dollars. I mean, look, there's a lot that needs to be done, that can be done, that should be done. It's not going to happen with Kamala Harris. I mean, think about healthcare, for example. Healthcare costs have been going through the roof. It has been an absolute, total mess. And it will continue to be a mess. I mean, we're looking at escalating healthcare costs that are going to way outpace inflation. I sat down with Dean Clancy just the other day to talk about this very issue. He's from AFP. He's a senior healthcare fellow there. I want you to take a listen to this interview, and we're going to talk about it on the other side. Here we go. Dean Clancy. Joining me right now with a look at the mess healthcare has really become, and also here with some answers on how to fix it all. Dean Clancy from AFP. He's a senior health policy fellow there. It is good to see you, my friend.
Good to see you.
I'm looking at some of these numbers. It's crazy. I mean, inflation is bad enough, right? But then when you look at healthcare inflation, that's a whole other animal. So it says that the health insurance premiums for families rose in 2023 some 7%, so therefore outpacing inflation, nearly $24,000 a year. They're expected to rise again with the expectation that by 2025, you're looking at prices increasing some 9%. I mean, that's not sustainable for people, Dean. Walk me through what's going on and why these are just up and away.
Health insurance prices and health care prices are going through the roof, and they've been doing so since Obamacare was enacted in 2010. And in fact, the price of health insurance has doubled over the past 10 years. And but we were promised in that legislation that healthcare costs would come down. They've doubled. And so we're clearly doing something wrong. It's squeezing the middle class, the medium family household income. It used to be healthcare took about 13% of your household income. Now it's about 26%. It's doubled in the last decade. It's squeezing the middle class. And it shows up in polls. People rank the high cost of healthcare among their top 5 issues consistently, along, of course, with the high cost of living, and immigration, foreign policy, other high-ranking issues. But healthcare is always in the top 5. And I think it's because the cost is going through the roof.
Well, I love talking to you guys. And by the way, if you're interested in this, I'm just going to say to the viewer, you can go check out personaloption.com. It's a plan that AFP has put together, and people really like it. They're very, very responsive here on the show because I think we're all in agreement that inflation's out of control. But certainly when it comes to healthcare inflation, it's really, really out of control. You say it goes back to Obamacare, and it's just sort of taken off since then. Is that because we're not seeing enough controls around it, or is it just the opposite, that you're not seeing enough competition around it?
It's the lack of competition and some very bad government rules and mandates that are actually incentivizing the big health insurance companies to drive their prices up. In a normal market, they would get more market share by reducing their prices and offering better products. But the government regulations, mandates, subsidies, and price controls have combined to incentivize them to keep driving their prices up as fast as possible, because that's how they maximize their profits. It's not a real market, and people are suffering as a result, and it's not sustainable. In a few years, I think you're going to start to see the crisis reach a critical point where employers start saying, you know what, we can't afford to offer health benefits to our employees anymore.
I'm glad you brought that up. I mean, that was my next question, because this, I thought, was being sort of put on the burden of employers primarily. Certainly when it comes to bigger corporations, it's obviously challenging for small business owners, challenging for them to take on full-time employees because you get to deal with the healthcare thing. But for these larger businesses, or businesses that are in the category of having to provide healthcare, what is it meant for them? How much of those costs are they passing on to actual families?
Unfortunately, employers are being forced to pass price increases on to employees. They do try to absorb those cost increases because they want to keep their workforce happy. Yeah. They don't do it gleefully, but they can't. They have no choice. The numbers don't work unless they basically pass the premium increases on. That's why you're seeing a 9% increase in the cost of workplace health insurance, which tends to be among the more affordable forms of health insurance. Mm-hmm. And the employers are no longer able to absorb the costs.
Right. I mean, so it's just eating into people's wages, which
right.
In and of themselves, I mean, you look at real wages, they haven't kept up with inflation over the last 3.5 years in any way, shape, or form. So all of this is becoming very, very burdensome on the average individual. I agree with you. Something has to change. Something has to give. What, in your view, and again, I want to just give a shout out for all the work that you guys are doing, and thank you for that, because we need people really digging in and understanding this. You can go to personaloption.com to learn more about how you kind of can take ownership of this, and how we as a society need to take more ownership of this. But what are sort of the big broad strokes here, Dean?
Well, at Americans for Prosperity, we say Americans don't need a government option in healthcare. We can't afford to double down on the policies that have given us this disaster. Let's give people a personal option. And by that, we mean let's remove government barriers to bring down the price of healthcare, make it easier to find a doctor, hospital that's convenient and affordable for you, that you trust, and let's empower consumers. Let's give them more control of their own healthcare dollars and decisions. Let's basically move in the direction of a more free market healthcare system. We don't have to eliminate government programs. We don't even have to repeal Obamacare, although there are mandates and subsidies and other things in it that definitely need to be reformed. But by doing this, and this can be done incrementally in a relatively nonpartisan way, we can bring down the price of healthcare, improve the quality, and reverse this relentless increase of healthcare costs.
What is the biggest problem? Is it government? Is it insurance companies? Combo? Where do you start?
It all comes back to bad government policy. And the health insurance companies have effectively become an arm of government under Obamacare, the Affordable Care Act. They've become government regulated utilities, and they are getting absolutely wealthy off of taxpayer subsidies, money that's going straight from the Treasury to the health insurers. And the hope is some healthcare trickles down to patients. That's basically what's happened. So healthcare insurers, government, they're one. They're one and the same anymore. We need to kind of break that up. We need to fund patients, not insurance companies.
Okay, so
not
how do
systems.
you do it? I mean, what is the personal option? How do you actually
Sure.
say, okay, we're going to put this more in the hands of the consumer? And obviously, you got to protect against something catastrophic.
Right.
But there's a lot of elective stuff, and we've all seen the numbers. You go to a dermatologist's office, and what you find is that, prices haven't increased in the same sort of stratosphere for elective health things that insurance is not going to cover versus, what you see in the insurance realm. So how do you take them out while still making sure they're there for, if the what hits the fan?
Well, the personal option plan basically consists of 5 elements. One of those elements is what you just talked about: strengthen government safety nets. In other words, protect people who would otherwise fall through the cracks, protect people with pre-existing medical conditions, make sure everyone has access to the health care they need when they need it at a price they can afford from the medical professionals they trust. That's one of the planks. The other 4 planks are, as I said, fund patients, not systems. That means basically taking those generous federal subsidies that are going right now to insurance companies, give them to the patients. And then the second plank, let the patients put those in a personal tax advantaged health savings account that they own and control, and let them use that for any qualified medical expense they want.
But don't we have that already?
We have HSAs today, but because of needless government rules, only about 1 in 10 Americans has access to a health savings account. Let's make that 100% of Americans. And
Sure.
So take those subsidies, put them in the accounts. Then the third thing is remove barriers so that there's basically it's easier to find the doctor, the hospital you want. Remove government red tape that limits how many hospitals can open up in your community, add new beds and so on. There's all kinds of
Oh my gosh,
barriers.
they have that too. See, there's like so much red tape that I don't even know about, right? And I'm decently immersed in this. I mean, I don't think your average American knows all of that red tape. I mean, to think that, if a clinic wants to open up or another hospital wants to open up, you can't.
No, you got to get a government permission slip in most states, and the board that makes the decision has the existing incumbent hospitals and entities on the board, so they protect themselves. They basically usually say no, and it's just an incumbent protection racket, effectively. It doesn't improve safety or quality or price. So let's get rid of those. Those are called certificate of need laws. We don't need them. And there are many other barriers like that. The fifth thing in our plan is direct access to doctors, meaning, for example, direct primary care. That's a new model where you just pay a monthly subscription to your favorite doctors, and for one low monthly fee with no extra fees or hidden charges, you get round-the-clock access for
But don't some
primary
doctors offer this? I mean, maybe you get it's concierge level service, whatever. I mean, it's something that I choose to do because you know what? I want to be able to call my doctor on Labor Day weekend if I need to be able to call my doctor. Not that he hears from me as much as he probably should, but there may be a time, and it's sort of, again, that's sort of that self-insurance, right? That I want to know that I have access.
Right.
I mean,
Everybody
can
needs-
people do that, or are you just saying it's not affordable enough because of regulations?
Well, what I'm saying is, DPC, direct access to doctors for primary care. That's like routine doctor's appointments and, non-emergency things. That's already exists, but there are barriers in the federal tax code that make it impossible to use, for example, your tax-advantaged health savings account dollars.
I know.
To pay for that. So there's a kind of discrimination against it.
You're right.
Economic discrimination.
You're right.
We want everybody to have the ability to use that. Now, do they still need health insurance? Of course. And that's why we need to reform Obamacare so that the price of health insurance comes down and you can tailor the benefits to your needs. You don't have to buy all the bells and whistles. It used to be this way. It actually worked pretty darn well. Health insurance was much less expensive before these mandates. We need to ease those mandates while protecting people with pre-existing conditions.
Sounds like a good idea to me. I want everybody to go check it out. Personaloption.com. Dean Clancy, a pleasure to see you as always. Thanks so much for joining us.
It was my pleasure.
My thanks again to Dean. Some really, really, really interesting ideas there. So let me change the the screen signage. Again, for those that are listening on Spotify and Apple, we thank you for that. Don't forget to rate us. Give us five stars only, please. And make sure you come over to the YouTube channel because we're live here. So guys, back to politics for a moment. I don't know if you caught this. This was going into the weekend. J.D. Vance made an appearance on CNN. This was ahead of the horror that unfolded there in West Palm Beach. But let me go to this because I'm kind of wondering if he sort of like ended her career. I'm joking a little bit, but not entirely. So Dana Bash is an anchor on CNN. See, we're equal opportunists here. We picked on ABC. We got to go over to CNN for a little bit. We hit, Morning Joe on Friday. So again, equal opportunists in terms of pointing out the insanity in the media. But J.D. Vance actually also pointed out the insanity in the media. Take a look at him really schooling, if you would, Dana Bash from CNN.
Dana, would you like to